Yes, we are live. Okay. Perfect. Hello, everyone, and welcome to our behind the scene program. Thank you for joining us today. We are live from Ottawa, and we would like to acknowledge that we are on the unceded and surrendered territory of the Anishinaabe Algonquin Nation. Behind the Scene is our monthly educational and bilingual workshop and presentation program. We alternate between French and English to offer educational workshops and presentations. Today's presentation will discuss how to connect with trans-affirming mental health providers in the city of Ottawa. We'll go over common barriers trans folks experience in healthcare settings, different ways to navigate the mental health system, and how MAX Ottawa's mental health navigation program can be of service. We will also take a look at a few online and short-term counseling resources free to access in our area. Just a reminder that this presentation will be recorded and available on our YouTube channel at MAX Ottawa. Feel free to ask your questions in the chat, and we will be happy to answer them at the end of the presentation. We are lucky today because we are here with Charlie Dazé. Thank you, Charlie, for presenting today. Charlie uses they, them pronouns. They are a health navigator at MAX Ottawa, running the mental health navigation program. They are deeply passionate about accessible, affirming healthcare and are an advocate for trans and non-binary youth. In their spare time, Charlie loves to read queer sci-fi fantasy books, play video games, and write at unreasonable hours of the night. Thank you, Charlie. We can start whenever you're ready. So I will share your presentation.
Let's do it. All right. Well, hello, everyone, and thank you so much for joining. I'm so excited to be here speaking about this today. Like Khaled said, how do trans non-binary folks in Ottawa access affirming mental health care? Let's jump right in. And I do want to start this presentation off with a content warning. So there will be discussion of transphobia and suicide as well, mentioned briefly today. I don't have any like explicit or like graphic examples prepared. My intention is to keep this quite broad in scope, but just so folks are aware of ahead of time, those words will be coming up, absolutely. So, the mental health system in Canada is by no means easy to navigate. It can be very easy, especially for folks who are entering this healthcare system for the very first time, to feel overwhelmed and to not know where to start. And this is where myself and MAX Ottawa and the Mental Health Navigation Program come in. So we're going to start by taking just a broad look at Canada's mental health system as a whole. This is a system that ultimately is inaccessible in many different ways. So first and foremost, Canada loves to boast about our free healthcare to other folks on a global scale, but as we know, this isn't always the case, particularly when it comes to mental health. It can be quite expensive. At MAX Ottawa, we have a database of providers who serve our community broadly, and we're constantly chatting with providers about their practice, their skill set, their specialties, their experience serving our communities, and we also keep track of who is charging what for their services. So in our database at the moment, our lowest providers are charging between $60 to $75 per session. Our mid-range providers are at $100 to $150 per session, and our higher-end providers are charging between $175 to $250 per session. So for someone who is new to accessing mental health care, this can be really deflating because it's quite expensive. I will say as well, just because a provider is charging a lower rate does not mean they are a worse provider than someone who's charging a higher rate. Oftentimes, providers charge lower rates in an attempt to be more accessible to lower income communities. The trans community is one example of that. So I will say, if you're reaching out to providers, don't feel discouraged that someone is offering such a low rate. It doesn't. It's not a reflection of their skills by any means. It's oftentimes just an attempt for them to be more accessible. And we do have providers in our database as well who charge a flat rate of, let's say, like 120, 150 bucks per session. And then they also offer like affordable fee programs. So they have, for folks who are lower income, the option to be placed on a sliding scale, maybe ranging from like $60 to $100 per session. And depending on someone's level of income, you can come to like an independent agreement with a provider. So you can pay less, ideally. Now, as we've seen during the pandemic, the healthcare system generally is prone to really long wait lists, and trans folks in particular are no stranger to that. In the mental health care system, it is no different. For folks who are stepping in for the first time, unfortunately, we do have to expect wait lists are just a part of the reality. At their worst, waitlists can be up to a year in length. At their best, you can see folks within the space of 1 to 2 weeks. Generally speaking, the average, at least from where I'm standing in my own work, the average seems to be kind of evening out at 3 to 4 months of a wait time in length for folks who are looking to see new mental health providers for the very first time. So unfortunately, a reality of our system is we do have the expectation that you might need to wait a little bit before you can see a provider. Now, fun aspect of Canada's mental health system is there's a very broad range to the types of providers who are available for folks, for clients to work with. So we have social workers, we have counselors, we have psychologists, we have psychotherapists, we have psychiatrists, we have therapists. But what does it all mean? Well, that's a wonderful question. Now, this is going to start sounding a little bit like a school lecture, so I do apologize for that. Please bear with me. But this is information that I feel is really important for folks to know ahead of time in advance of trying to locate a mental health provider. It'll help you make a decision on who is going to be the best provider for you. So, I have scoured many different websites and sources across the internet trying to find a clear distinction of the definitions between social workers and psychologists, because these are two titles that are often lumped as being the same thing. So far, my favorite distinction was found through the Canadian Association for Social Workers, but there are a lot of other definitions that kind of vary for these roles out there as well. But I'll just jump into kind of like a light introductory definition of these different titles that you might encounter when you're trying to find a mental health provider. So social workers are RSWs, registered social workers, who conduct essentially like holistic or like very broad, all-encompassing assessments and interventions. So they consider essentially all elements of an individual's life in terms of providing mental health care to them. So they're looking at social, familial, like economic, physical components of their clients' lives, and it expands even beyond that to come up with a plan to help their client. Psychologists, on the other hand, are a little bit more narrow in their practice. So they're assessing and diagnosing problems in thinking, feeling, and behavior. So essentially, they're a little more cognitive in their basis, and they can help folks to overcome or manage their problems using a variety of treatments or psychotherapies. And psychologists are also trained to use psychological tests to help with assessment and diagnosis. Now, social workers and psychologists are most likely, for the folks who come through our mental health program at MAX, and generally speaking, folks who are seeking counseling or therapists, chances are you're going to be working with someone who is either a registered social worker or a registered psychologist. These folks, when they are working in their field as counselors specifically, are very similar in skill set, and it's usually just how they obtain their licenses or how they obtain their certification that is kind of like what differs between them. So many psychologists can go up to like a PhD level of study, whereas social workers tend to kind of cease their studies at the master's level once they get their MSW. Generally, both fields have like similar clinical training or practicum opportunities when it comes to counseling specifically. In my own understanding, in my own work in this field, psychologists focus solely on attending to mental health issues, whereas social work is much, much broader as a field. So it's focusing on human wellness overall. Again, there's a lot of overlap in these areas, which is why social workers and psychologists are often lumped together. And I hope that description is not too confusing, because now I'm going to jump over to psychiatrists, which is something that folks in our community are also frequently looking for. Psychiatrists are medical or clinical professionals. So they have the capacity to diagnose mental illnesses and prescribe medication to treat them. So they provide psychiatric assessments, treatments, and rehabilitation, essentially. MAX Ottawa, at this time, we cannot make referrals to psychiatrists because we are not a clinical program by any means. I myself am not like a licensed social worker or a licensed psychologist. My goal for my work at MAX is to connect you with someone who is. So psychiatry is a much more like clinical field and kind of a whole other category in comparison to social workers and psychologists. Now, finally, we have counselors, we have psychotherapists, and we have therapists. These are other titles that you might see mental health providers using in the system. These can often be used interchangeably and used kind of loosely, and they don't necessarily identify a person's capacity to work in the mental health field or identify like their specialty to work in the field or the amount of training they've received. Essentially, these are titles that are non-regulated in the mental health system. So there are a number of like voluntary regulatory organizations that counselors can become certified with and have their skills like monitored from there, but they are not a mandatory regulatory service. Whereas with social workers and psychologists, their certifications and their ability to practice mental health care in Ontario is like regulated, and that regulation is mandatory essentially. Now, that's a very long spiel out of the way. Why is this important? All that information, despite how kind of convoluted and confusing it might be, and again, there's really no like clear answer to all of those definitions, it is important to know at least kind of the preliminary distinctions, because knowing which skill set you want to see in a provider is really important. And as well, for folks out there who are lucky enough to have insurance when it comes to accessing a mental health provider, insurance providers cover different types of mental health providers, essentially. So if you're lucky to have insurance that covers mental health services, it does not necessarily mean that they're going to be able to cover both social workers and psychologists. They may cover one or the other, or they may cover neither. So if you are out there looking for a mental health provider and you have insurance, it's really important to check in with your insurance provider and confirm which type of mental health provider they are covering. So then when you go out and you do research or you reach out to our mental health navigation program, we can narrow down kind of the fields for their based on the qualifications that the provider is working with. Now, this is where we're going to get into some of the heavier stuff, but all of those barriers, general barriers that I just spoke of relating to the mental health system and how inaccessible it is at the moment for folks, generally speaking, in Canada, trans folks have some additional barriers with regards to accessing mental health care that they need to deal with. So just to name a few that we have here, it can be a challenge for folks to find providers who will use the correct name and the correct pronouns for them. Not everyone who is accessing healthcare services is necessarily going to have their legal changes made, but it is very important that healthcare providers in any context use the appropriate name and the appropriate pronouns that a trans person wants to be identified by. Not all healthcare providers out there are, they can openly state that they are affirming to trans identities, but that doesn't necessarily mean they're going to be competent in trans experiences. So for example, sometimes providers, mental health providers specifically, state that their practices are open to the 2S LGBTQ+ community as kind of a general statement, which is great. And we love to see that like initiative to be inclusive towards the community, but sometimes folks don't necessarily understand the nuances of what a trans person's lived experience is going to be versus a cisgender queer person's experiences. And the nuances and the differences in lived experiences can really expand from there. But it is really important for mental health professionals to understand like the terminology that folks are using in the trans community, how we identify ourselves, healthcare system as a whole as well. So for example, as I mentioned, trans folks are no strangers to long wait lists. It is accessing trans healthcare for folks seeking a medical transition. It does not happen immediately. Oftentimes folks are on a wait list for a year or longer before they are able to access like the medical transition resources that they need. So long wait lists, of course, can exacerbate struggles related to mental health, and understanding how those factors tie into one another is really important for mental health practitioners to know. And when they don't, that can create an additional barrier for trans folks who are seeking mental health support. As well, understanding that trans identities are not all binary in nature. So finding providers who are affirming to non-binary, two-spirit, gender fluid identities, etc. All of that can be a barrier for trans folks as well. This is something that's frequently seen in like medical settings where trans folks aren't necessarily comfortable or don't feel like worried about disclosing their identity as a non-binary person, for example, because they're worried that their care will be taken away if they don't meet like conditions X, Y, and Z that medical folks feel is important related to being trans and like accessing trans-affirming services. There can also be concerns about client confidentiality. So anytime a trans person comes out as trans or identifies themselves as trans to anyone in any kind of a public setting, it is always a risk because you never know where, like, who else that person is out to. Maybe it's very few people. Maybe a medical provider is like the first person a trans person is chosen to come out to. So worries of maintaining that client confidentiality can also be a barrier for trans folks who aren't familiar with the mental health care system. Now, it was not very long ago that trans identities were essentially diagnosed as mental illnesses. And folks needed a diagnosis from a doctor and from a mental health provider, so like a clinical psychologist who could diagnose them with gender dysphoria, and they needed to have that diagnosis in order to access other gender-affirming sources of care. This is an issue because mental illnesses are framed in a context of this is something that needs to be solved. This is something that requires treatment. And essentially, they're framed in a very negative light. So when you pathologize trans identities as mental illnesses, it begins to frame trans identities in a context of this is something that needs to be solved, or this is something that requires rehabilitation, which, as we know, is not the case whatsoever. Trans identities are, make us like whole human beings, and they're an integral part of our identity. As well, some other kind of examples we see in mental health care settings is using transness as the source for everything bad. And essentially what I mean by this is there's kind of a running joke in the community where if you like go to the hospital with a broken leg, a healthcare provider will be like, "Oh, you're trans. Being trans must be the reason why you broke your leg," despite those two having like zero context or zero relation to one another. So similar to a mental health care setting, not every single trans person who is seeking support for their mental health is doing so with the intention of like their trans identity being the source of everything that is wrong in their lives. Being trans is just one component to our identities. It is not, everything that's up in our lives. Trans folks can lead very full and very happy lives, and trans folks can have things go horribly wrong in their lives that aren't related to transness whatsoever. So finding mental health providers who understand this and essentially lead from a client-focused or a client-centered kind of provision of care, and letting trans folks speak for themselves because they can advocate for themselves and advocate for their own needs and speak on which areas they are in need of support of. It's just so much better than making that immediate assumption that all trans folks must suffer horribly from their mental health. And it is their trans identity that is the root of all that, which just isn't true. Now, as I mentioned earlier as well, another barrier to the mental health care system, and particularly in the trans community, is financing. The trans community historically is a poor community as well, or a community that has experienced discrimination in areas like the workplace and with housing and that sort of thing. Not to mention, if anyone is accessing a medical transition and does not have it covered by insurance, it is going to be very expensive. So this is a community that does not typically have a lot of financial resources at their disposal, which is unfortunately another barrier to accessing gender-affirming care in a mental health context. So that is just kind of a handful, another long spiel, but a handful of the other factors related to struggling to access mental health care for trans folks. So let's say you are a trans person listening right now, and you're like, hey, I really want to access a mental health provider and feel very overwhelmed with the system. And gosh, I don't know where to start. But let's say you found a mental health provider and you have your first conversation with them. Most providers have like an intake conversation with their new clients that usually lasts for 15 to 20 minutes. And they go over, like they like to learn a little bit about the client. They usually will chat a little bit about themselves and their practice. And the whole point of introductory conversations, kind of like preliminary communication with a mental health provider is this going to be a good fit between yourself and the provider and between the provider and their client? Now, for trans folks, in terms of accessing mental health care, my recommendations are twofold. One, my first piece of advice would be just to advocate for yourself early in mental health contexts. So let's say you're in that kind of like preliminary intake conversation with a new provider. I highly recommend, if you're comfortable, asking questions. If this is a provider you're going to be seeing long term, you want it to be a good fit, especially if this is a provider you're paying money for. So an example of a question is you can ask what experience the provider has working with trans folks or working with the trans community generally. The questions you can ask can really expand from there. But this is a really good one just to get a sense of what experience that your provider, your hopeful provider, has working with the trans community in the past. What is their competency level working with the trans community? What is their knowledge of trans experiences? And generally from folks, what is the word? Their answer that they give you. You can get a pretty strong sense of where they stand and their comfort level in terms of serving the community. And that's really important to know ahead of time. It's not something you want to find out, like 10 sessions in, because that would be very uncomfortable. And I find it's a lot easier to ask those questions during an initial intake call as well, because they're usually just over the phone. They're not necessarily going to be in person. So if you ever feel uncomfortable as well, you always have the option to just hang up the phone. You kind of have that like extra level of safety in there as well. This one's a little bit more broad, but also relates to trans folks. If you have an insurance provider that does not cover a specific type of a mental health provider, so let's say you really want to speak with a psychologist, but your insurance provider only covers RSWs, you can reach out to your union or your workplace or your benefits provider and ask them if they can include this specific type of mental health provider in your insurance plan as well. I can't guarantee, of course, that asking them will like immediately fix everything and will get you access to that like provider through your insurance plan, but it's another piece to advocating for oneself in terms of just increasing access to care. And if enough folks do it, if enough folks push for it, you can definitely see the change happen. My other piece of advice for trans folks looking to access mental health providers is rely on your community resources. There are multiple organizations within the Ottawa area specifically, but also in Ontario more broadly, that are essentially their whole mandate is to work with the trans community and advocate for folks' access to appropriate care. MAX Ottawa is one of those organizations, and I'll jump into some others as well. But we're going to start with the Mental Health Navigation Program at MAX Ottawa. So this is a community resource that, as Colette mentioned, I work as a health navigator at MAX Ottawa. So I run this mental health navigation program essentially on a weekly basis. What I do is I connect our community members to mental health providers who I feel would be a strong fit for them. So the way our program works is I essentially conduct an intake with a community member who wants to go through our program. We chat about your needs, some of the things that are going on in your life, and we explore a few of the options that are going to work best for you. Step 2 is I take about the next week and I compose what we call a mental health navigation plan. This is a list of usually 3 to 5 different providers that I feel would be a strong fit and that work for the individual financially as well. And it is a list of referrals that you can take. And from there, you can go off and reach out to any of those providers on that list and start your kind of entry point into the mental health system. Currently at MAX, we can refer to psychologists and social workers and other forms of psychotherapy. We also have a lot of other community-based resources in our database, so we can refer out to like support groups that are local in the area, any other kind of community resources you might be looking for. Again, relying on those community resources in terms of accessing support, super important. And then the final step for the program is I conduct follow-ups as well afterwards. So I'll keep in touch and just check in on your progress and connecting with a mental health provider. As I mentioned earlier as well, this is not a clinical program. So I myself am not a licensed like mental health practitioner by any means. My goal is to connect you with someone who is. So yes, we also make referrals to local support groups and other community resources. How can you reach out to our program? There are 2 options. One, you can go to our website, which is maxottawa.ca. If you go to the mental health portal on our website, which is just underneath the programs tab, and you select the mental health navigation tab, you can fill out an online form that will go directly to our navigation email, which I monitor, and I will reach out to you from there to schedule an intake. And as well, if you ever want to email navigation@maxottawa.ca, if you ever have just a general question about accessing mental health care in Ottawa as a trans person, I'm more than happy to just chat about that generally as well, and would love to hear from you. Now, know your resources. So I mentioned there are many organizations in Ottawa serving the trans community in a like a health and wellness and just general support context. There are 3 listed here. There are some others, but these are ones that I felt were really pertinent for this presentation today. So first, we have support and education for trans youth, also known as safety. As the name suggests, this is an organization that works in like an educational and support capacity for trans youth, but they also work just with the trans community more broadly. Safety has something called a Me Fund, which they just launched their March form for it. But essentially, every month they draw 3 names randomly from their applications and gift $150 to trans folks in the community who are in need. It's online. It states that the funds can go towards, or intended to go towards, like a name and legal change, which is fantastic. But the funds can also be used for anything that you need, really. So, for example, if you're seeing a mental health provider and worried about payment, that's one option to get some funds toward going directly towards your own health and wellness as well. Next up, we have Rainbow Ottawa Student Experience, also known as ROSE. They have both an advocacy and a community care team. I realize, well, their email addresses are there as well, but essentially very similar context of work. They work mostly with students, as the name suggests as well, so usually younger demographic. I want to say like 30 and under, but really it's for anyone who identifies as a student. If you're ever in need of like advocacy support in a healthcare setting, this could be an option. Community care is another option as well. Essentially, we all like to stay connected as organizations because when we have community members who reach out, oftentimes we'll like refer or defer to one another for advice or to just kind of create a plan of best action in terms of supporting that community member. And KindSpace is another organization as well. I mention them because they have support groups for the trans community specifically, and are a really great resource for that. And I cannot stress this enough, especially since the mental health care system can be so inaccessible at times, both in terms of like waitlists and finances. Peer support in terms of mental health support can be a really beneficial resource for trans folks. Community care is a real thing and is really valuable. And I highly recommend just connecting with other folks in the community. There's a lot of different ways that you can do that, but it can be a really healing way to just connect with others of a similar lived experience while you're waiting for some more like kind of clinical or deeper mental health resources. Now, I'm going to jump into some free mental health resources. These are all short-term counseling resources. So our first one is Counseling Connect. This is a free single-session counseling service. Depending on where you go, sometimes you can have up to 3 consecutive appointments at one time. This is determined on a needs basis. And this is an online resource. So essentially on their website, you can select your preferred specialty. So for example, if you're looking for a provider who is trauma-informed or who works directly with the LGBTQ community, the website will list providers from that background who are based in Ottawa. What's nice about this one is there's like very little communication. You don't have to make a phone call or kind of send an email. You can just schedule an appointment directly on their website and essentially the provider will contact you through either like a virtual or a phone therapy session at the time of your appointment. All providers for the Counseling Connect walk-in counseling services are from quite a broad clinical background. And just as an example, Counseling Connect is partnered with multiple community health centers in Ottawa. So the providers you see are not just working like for Counseling Connect like as a website directly, they are also working in a healthcare context in Ottawa. And one of those partnerships with Counseling Connect is Centertown Community Health Center, who is right next door to our office at MAX Ottawa. But they offer a 2 LGBTQ+ walk-in counseling service. So this is another free single-session counseling service. I like to say this one is useful to have in your back pocket just in case of an immediate need. But essentially, this is a program that runs on Wednesdays from 12 to 6:30 p.m. They offer a limited number of same-day phone appointments with a counselor. So what you do is you reach out to their email address and say, hey, I would like to speak with a counselor today, and they'll put you on the list, and a counselor will reach out to you through phone at your specific appointment time. And there's more information available on their website as well. The Centertown Community Health Center also offers longer-term free counseling services. Generally speaking, it's from a period of 6 to 8 weeks in length, and is for folks who live in Centertown or in Glebe, kind of that area generally. So if you happen to be someone who lives in that area, I highly recommend just giving the Centertown Community Health Center a call and see if they, when they could potentially fit you in to speak with a counselor on a longer-term basis. If you're like me and you're not a huge fan of phone calls or like cold calls, you can also reach out to us at MAX Ottawa, our navigation email, navigation@max.ca specifically. I'm more than happy to reach out to the community center on your behalf to make that referral as well. That is totally something we can do. Now, peer support lines. As I mentioned, we have peer support is a really beneficial kind of source of mental health support in a context of waiting for like further mental health services. It can be really beneficial just to reach out to these supports for now while you're waiting. So aside from support groups, there are a lot of other like online, like virtual and kind of more like one-on-one based resources available as well. So just a few of those include the Trans Lifeline, which is a 24/7 national helpline. So they work all over Canada. I think they might work in the United States as well. But essentially, Trans Lifeline is an organization that is trans-run and trans-led. So you will be speaking with another trans person on the phone or on their website as well. I think they have a chat function. But essentially they offer like crisis support, they offer general support, just folks who are struggling and want someone to talk to. They're a really great resource for that. And they also have like community referral resources. So they can, if you're not sure like what like trans-affirming resources or like kind of medical systems are available in your area, they can help you get connected to those as well. LGBT Youth Line is an organization that is based in Toronto. And they do a lot of work with youth in like rural settings as well, which is really cool. But the Youth Line offers confidential, non-judgmental peer support, and they have phone, text, and chat services. And they run Sunday to Friday from 4 p.m. to 9:30 p.m. So they are an evening resource. They are, again, based out of Toronto, but they serve Ontario more broadly and have a website as well. So I highly recommend checking them out. And then for folks who speak French, for folks where French is their first language, Interline is a service based out of Quebec that is offering 24/7 support. And again, this one is a similar to Trans Lifeline, and that it's a call service. So yeah, pretty straightforward. give them a call if you're in need of kind of like immediate mental health support. And as well, Max Ottawa has a peer support program as well. So if you need some extra, emotional support, if there's someone you just really feel the need to like vent to, or someone you just kind of want to chat with, Max has a really wonderful team of volunteer peer supporters that are here for you. They are available through phone, video chat, or we have an online chat function on our website as well. It's an instant message, and we run every weekday evening and weekend. For any more information about that, I highly recommend reaching out to our mental health programs coordinator, Spencer, who works at Max Ottawa. The number and email address is there on the slide as well. But essentially, this is again a non-clinical resource. So I would not go to this resource looking for like therapeutic like a clinical therapeutic support specifically, but this is someone if you just need like a little extra emotional support, if you want someone to chat with or to vent to, it's a really great option as well. Now I have some crisis lines listed here as well. These are services for if you are experiencing a mental health emergency. There are options that you can reach out to. So there's two. We have the Ottawa Crisis Line. So this is someone you can reach out to for crisis support specifically, or for further connection to mental health services. They run in both English and French. And they also have the Champlain District Crisis Line, which is for folks who are outside of Ottawa and potentially living in more rural areas. We also have the Ottawa Distress Line, which is a little bit more broad in scope. It's essentially folks who work on the distress line can provide you with emotional support, encouragement, crisis management and intervention, as well as suicide risk assessment and prevention. So essentially, these are folks with, if someone is experiencing suicidal ideation or experiencing suicidal thoughts, they can essentially create a safety plan with you if you're in that situation. So definitely, if you're in a state of crisis, I recommend giving them a call. And as well, they also have the community resource and referral information, so they can refer you externally to other resources as well. Also important to note, you don't just have to call these resources. Both of them work in partnership to offer a chat text resource as well. Now, that pretty much sums up all of my presentation. I would like to say I realize that there's only one photo in that entire presentation, so thank you for bearing with that whole long vocal spiel of a PowerPoint. And for the folks who watched, I present to you a compilation of trans-affirming puppies to end this on a better note. So thank you for listening.
Thank you, Charlie. I'm just gonna... Sorry for the puppies. Thank you so much. Very important presentation with various resources. I just wanted to add that on the Canadian Counseling and Psychotherapy Association website, when you look for a therapist, if you're looking for a therapist, they have this option of finding a therapist who offers pro bono services. I'm not sure if they're culturally competent to work with different groups, but you gave us some tips on how to advocate. So this is just something I wanted to mention. I'll put the link in the chat. And
that's a really great point. And as well as Max, for folks who come through our mental health navigation program, we do on occasion work in partnership with other mental health providers to offer pro bono services to our community members. This is not something that is consistent. It is usually done on a needs basis, but it is an option as well for folks who are really struggling. So yeah, I definitely recommend, kind of like I mentioned, it's really great to just get out there and look at like the resources available to you. You never know what you can find. It is absolutely trickier, I'll say, to find mental health resources for folks who cannot afford them, who don't necessarily have insurance, but it does not mean it is impossible to find those services. And that's why we're here. That's why we exist. We really try to narrow down the field for folks and get them connected to what they need.
Thank you, Charlie, and thank you for working hard on expanding the database and working on partnerships, and it's really great. We've received 3 questions, 2 in Instagram and 1 here, 2 through Instagram and 1 through the chat here, and then we also have a comment. So the 2, I will start with Instagram questions. So the first question is, can you provide mental wellness tips, advice for those who are on the wait list for care?
So just like general mental wellness tips.
I think so.
I can do that for sure. Just confirming. I'm just thinking back to the time I spent on like wait lists myself and waiting for like gender affirming care. A big one for me was one, just cutting yourself a break. It's this stuff is hard. It can be really tough living as a trans person in a cisgender world. So just cut yourself some slack and give yourself as many breaks as you can. Something I really love doing personally was I had what I called like a dysphoria box, or like a dysphoria compilation of essentially items that were really affirming to me that I went to when I was feeling particularly like upset one day. So as an example, like the dysphoria hoodies are really great for really great for my mental wellness, in the sense that it was clothing that made me feel like really comfortable and content within myself. And allowed me to kind of just get through the threshold of whatever day was particularly sucky. And I will say as well, it can be, particularly during the pandemic, it can be very isolating to be trans-identified, and it can at times be really tricky to find other folks to identify within the community. So a really big source of kind of getting myself out of my own negative headspace was just finding community connections as well. And it doesn't necessarily need to be folks you see like regularly in person. It can be resources online. I know Rainbow Ottawa Student Experience, Rose, has like an online Discord that folks can join, that has like hundreds of folks, including hundreds of like trans-identified folks in the city, who can all connect online there. So it's really a matter of cutting yourself some slack and also taking initiative for your own wellness. And sometimes you do just, it's tough, but I would say putting yourself out there, once you do, you'll see the whole world kind of begins to open up for you.
Thank you, Charlie, and thank you for sharing examples from your personal experience. The second question we received via Instagram. I want to learn more, but my family disapproves. Can I see someone online?
Yes, you definitely can. With regards to, I'll say for our mental health navigation program specifically, there are a lot of different options for accessing that program. So we can either meet in person, or we can meet over the phone or through video chat. We can also just chat through email as well. That is also an option. And the same thing applies to providers. At this point in time, most providers are not offering services in person just because of pandemic restrictions. I imagine that will start to open up again in the next few months. But a lot of providers are offering their services over the phone or through a video chat as well. Depending on where you are, if things aren't necessarily safe at home, it's not necessarily an option I would recommend, but that's definitely a decision you make for yourself. Well, there are providers out there as well who are open to just doing like chat services like texting or email as well. So there are definitely a slew of options out there for you.
Thank you, Charlie. We have a comment and a question that I will read for you. The comment is regarding using transness as the source for everything bad. This is such a huge problem. That's why you mentioned at the beginning.
Yeah, I have a recent personal example I can throw out there as well. Just for folks who are curious, I was at an eye doctor maybe about a month ago, and we had run some tests and realized that there was like pressure building behind my eyes that's quite high, and trying to find a cause for it. Not a huge deal, but my provider or my optometrist immediately went to, well, you're a trans person on testosterone. Maybe hormone replacement therapy is what's causing this health issue for you. And I was kind of like, like, I don't know. I've done a lot of research on HRT and made sure I was like well informed. My doctor, gave me like a whole list of the side effects in advance of like prescribing it. And granted, there's, a lot more research that's needed in the sphere of trans healthcare. But still, it felt like a little off the cuff, and I was like, I don't know. So my optometrist right there went and Googled it essentially, and found that actually the complete opposite is true. And it's often high percentages of like estrogen and progesterone, and often what are referred to as feminizing hormones that can cause like high pressure behind the eyes. So it's just one example of a provider essentially using like transness as a means of like finding an issue that someone's dealing with when it's not necessarily related whatsoever, and just silly. And yeah, totally agree with you. It's a huge issue where healthcare providers, I think, get very nervous dealing with trans folks because they aren't necessarily trained or equipped to deal with folks like in a context of trans healthcare. So they immediately just like kind of hold on to the trans identities as a bit of a lifeline and be like, it has to be the issue for everything.
Wow. Thank you, Charlie. I'm always happy that Google is here to help healthcare providers because they're
Totally.
stuff. Yeah.
Yeah. It was just a quick search.
Google saving lives.
Yeah.
Next question we have is, after I read your bio, we have this question. Oh, I know it isn't relevant, but can we get recommendations for good trans fantasy titles at the end of the presentation? Maybe I'm just a giant nerd before anything else.
Oh, yes. Well, of course. I love that question. The most recent one that I read was Cemetery Boys, which came out, I think I want to say it came out in March of last year, but I read it over the winter break. Essentially, Cemetery Boys is a book written by an author named Aidan Thomas, who's transmasculine, and it's about a young trans boy who essentially has recently come out to his family. It does not go very well, and his family has like a ritual where essentially they help ghosts pass on to the afterlife, and it's only the men in the family who practice that ritual. And he goes on this gigantic journey of essentially, because of course, he's male identified, and finds out that he has the ability to help these ghosts. And he essentially goes on this huge journey to help this one ghost to prove to his family that he is a man. And there's obviously a lot of really interesting discussion in there of like, do we need to prove to our family members like how we identify? They should just accept us as we are. And there was a queer romance story in there as well. And I really liked it. So it was called Cemetery Boys by Aidan Thomas. That's one of my favorites. What are some other ones? The Passing Playbook is another one. The Witch King, I don't think that one's fantasy, but The Witch King is another one. That one is fantasy. Gosh, I could give a whole other presentation on this subject matter, but I will leave it there for now.
Thank you, Charlie. And Yay and Cemetery Boys was so good.
Awesome.
Thank you to the different participants. Thank you, everyone. I think I can see. Oh, we have another comment here. Thank you for this amazing presentation. Yes, thank you very much, Charlie. It was very interesting and important. We will make sure to post on our social media channels the different resources that you shared. And you're always available to help through our mental health navigation program. So thank you for that. I see no other questions. So I think I will stop the live.
Thanks, folks.